Good morning, afternoon, and evening, everyone. Thank you so much for joining the Track 3 plenary session. It's entitled, Cost Analysis is Essential Before Considering Scaling Up Micronutrient Interventions. My name is Heather Danton. I'm the Project Director for USAID's flagship Global Nutrition Project, USAID Advancing Nutrition, and I will be moderating this session over the next hour and a half. Through these presentations, we aim to highlight the need for and value of cost analyses undertaken both before investing in micronutrient intervention programs and after program choices have been made. In this session, we will hear from 4 outstanding experts in the fields of economics, nutrition, health, and policy, followed by responses and analysis from a panel of 3 experts. The first 3 presentations will be made by Dr. Stephen Vosti from UC Davis, Dr. Omar Dari from USAID, and Keith Levibny from Harvest Plus. Immediately following these presentations, Dr. J.V. Meenakshi from Delhi School of Economics will share her reflections on the importance of cost analysis for policy. We will then turn to the panel comprised of Dr. Carol Levin, Dr. Zia Haider, and Dr. Jack Clift, and they will share their reactions with us. I will indicate to the presenters when they're close to the end of their allotted time. We encourage you to add your questions to the chat box as we go along. We'll do our best to get to as many of these as possible before our time runs out. However, if we do not get to your questions, our presenters and panelists have agreed to respond to any questions that have not been answered after the session has ended. I believe they'll be able to get back to you via email. The many excellent sessions supported by this conference make it abundantly clear that while countries have a range of mechanisms or approaches to addressing micronutrient malnutrition, for example, through fortification of staple foods and condiments, biofortification, agrofortification, supplementation, etc., it's complicated. And making decisions about which interventions to invest in requires some understanding of cost. So what do we know about the costs of some of these micronutrient intervention programs? And what should be considered in determining what intervention or interventions to use? To get us started, Steve Vosti has agreed to set the stage for this session. He will then lead right into a long presentation that draws from this work in Uganda and Cameroon using the Minimod tool. Stephen Vosti is adjunct professor in the Department of Agricultural and Resource Economics at the University of California, Davis. Steve currently leads a team comprised of nutritionists, economists, and policy engagement specialists in developing tools to inform the design and management of more cost-effective micronutrient intervention programs and policies in developing countries, with a particular focus on Burkina Faso, Cameroon, Ethiopia, Nigeria, and Senegal. Thanks so much for kicking off this session for us, Steve.
Thank you, Heather, for the introduction, and thanks to everybody who's participating in this session in the 2020 Micronutrient Initiative Global Conference. Thanks for taking the time. I have 2 jobs this morning, First is to set the stage for this collection of really great presentations. And then the second is to make the lead-off presentation on behalf of colleagues at the Minimod group and at the former Spring group. So let me begin by setting the stage. First, we all agree that undernutrition contributes to the global burden of disease and to excess mortality. We also agree stakeholders are increasingly committed to identifying and solving these problems. We also agree that the long-term solution is adequate diets for all. That's what we really want to aim for. But we also understand this is going to take a long time, and we do not have the luxury of waiting for these long-term solutions to evolve, even though we should continue to invest in them. So what to do in the short term? There are many options, as Heather pointed out. Staple food fortification, fortification of condiments, agrofortification, biofortification, lots of things that one could do. But we also know that we cannot do everything everywhere forever. We don't have the financial and the human resources to do this. We also know from Lindsay Allen and others that we probably should not do everything everywhere forever, because there are risks associated with excess intake for some of these micronutrients. So in the end, all life is constrained optimization, and we have to choose. We have to choose what to do, and by default, we have to choose what not to do. When, where, how long, how to deliver micronutrients, and to whom. And we need to remember that diets and nutritional needs vary spatially, and so do the benefits and costs of intervention programs, and that nothing is free, and that some inexpensive programs may not be worth doing, and some expensive programs may be worth investing in. So what do we need to know to inform these choices? And this is going to be one of the mantras of the entire micronutrient forum is know your problems. You have to invest in collecting data to understand dietary intakes and the effects of these different dietary intakes on nutrient status. You have to invest in the tools and the people who can then analyze these data for you. You need to define very clearly what your objectives are. There are lots of ways to define success. You need to agree upon them and make them concrete. You need to prioritize among these objectives, and you need to speak with a common voice. You need to know your existing programs, and you know them, and to know the measures of impact associated with them, and actually go out and do the hard job of collecting the data to see what these programs are delivering for you. You need to invest in data and models to understand alternative programs. What else could you be doing instead of what you're doing, or perhaps in addition to what you're doing? You need to know the cost of existing programs and alternative programs, and you need to link these costs with the expected benefits, and that's what this particular session is all about. Now, why is bravery sometimes required? And hence the title of my introductory talk. Well, everybody wants to know something about cost, but I guarantee you that nobody wants to know everything about cost. So you need to bravely learn and report everything about costs, but then you need to wisely identify what bits of this cost information get shared with different stakeholders. With cost analysis comes bills to pay. And believe me, nobody wants to pay these bills. And so you need to bravely manage the dialogue associated with deciding which stakeholder groups are going to cover which costs associated with intervention programs, and don't leave the bargaining table until these agreements are reached. Not all intervention programs are worth implementing or keeping. All programs have constituencies. Some of these are noisy. You need to bravely identify candidate programs that should not be pursued, and existing programs that perhaps should be shut down. The good news is as soon as you identify a program for shutting down, all kinds of folks show up with efficiency investments that they can make. This is one of my favorite diagrams from the Minimod group. It depicts the number of cases of anemia that would be averted, or could be averted, by different levels of wheat flour fortification with iron in Cameroon. And what you see is that depending on where you are in Cameroon, you get very different answers to the question, how many anemia cases will be averted? This is not surprising because the levels of deficiencies are different in different areas, and the amount of wheat flour consumed is different as well. But if you look at the targets, this is what the Minimod tool would suggest that you would receive in terms of this particular benefit. But let's go to the field and actually see. And so if you go, we went in 2012 and collected data, and we went back in 2016 and collected more data. And what we discovered is that only about 50% of the targets were actually being met, which suggests that almost no benefits were being generated from this underperforming program. In this case, you have three choices. One, you can ignore the evidence. Be brave, don't let that happen. Second, you can shut down a program. That takes a different kind of bravery. Third, you can invest in the program to make it more effective and efficient. And I'm here to report that the Cameroon choice was number 3. And they have, thanks to information provided by Minimod and other groups, really taken this on for future investments. A few parting comments. First, we need to aim for efficient solutions. Let cost effectiveness be your guide. Second, In many cases, multiple intervention programs can be needed. All policymakers want home runs, one hit, and then you're done. But in many cases, that isn't going to be the case. We need multiple programs, and you need to be involved in coordinating and launching and planning these. Take site-specific and long views. This is all, you need to identify combinations of efficient programs that are likely to be site-specific. I'll give you an example of that in a minute. And you need to find practical implementation pathways. We need to suggest programmatic changes that are actually feasible. Have a plan for covering your costs. All costs must be covered by somebody at some point, and have a plan for doing this. Monitor and evaluate your programs, making sure that the evaluation agencies are well funded and that they have influence. These policies have to have teeth in order to be effective. And finally, keep an eye on the most vulnerable, with particular focus on women of reproductive age and young children. So with that, let me now transition to the first presentation, which will be made by me. I'm still Steve Oste, Ag and Resource Economics at UC Davis. And now I'm going to talk to you a little bit about identifying, combining, and managing more cost-effective micronutrient intervention programs, with an example from Uganda and an example from Cameroon. The Cameroon example will focus on meeting vitamin A needs among young children. It will have national and subnational foci or views. It will identify an economically optimal set of intervention programs, and then it will discuss the pragmatic policy pathways, what can actually be done. The next part of my presentation will focus on identifying cost-effective platforms for distributing multiple micronutrient powders to children. We're going to be looking at alternative platforms, taking a brief look at the composition of these program costs, how we can scale these things up, and noting that, and this is going to be one of my takeaways, is that we need to focus on the all-important final 3 meters. And I'll explain what that is in a moment. Let me begin with the Cameroon case study. What we have done here is to use the Minimod tool, and I refer you either to the literature or more conveniently to the Minimod sponsored symposium for an overlay of what this tool is and the various models that comprise it. Katie Adams and Raina Inglestone provide excellent summaries. Well, what I'm doing here is using the Minimod tool to identify what we call the business as usual for Cameroon. And Cameroon, for a long time, basically had 2 national programs. And SNC means South, North, and Cities, and that is the entire nation. And they had 2 programs. One was a vitamin A supplementation program using campaigns, and the other was a fortified cooking oil program that was working at about 44%. And the good news is these 2 programs actually worked in the sense that they effectively covered about 1.2 million kids per year, where effective coverage is, by definition, the number of children who graduated from inadequate intake of vitamin A to adequate intake of vitamin A, thanks to these 2 programs. The bad news is it costs about $3 million a year to manage these programs and to undertake them, and at a bottom line of about $2.49 per child effectively covered. Now, what we can do with the Minimod tool is to begin to experiment. Let's try something new. Let's develop a vitamin A fortified bouillon cube and deliver it via markets, understanding that it's going to take a few years to do this. Let's introduce biofortified maize, again delivered via markets, and understanding that this is not going to happen in 1 year. And let's make improvements to the fortified oil program over a 3-year period. Then we ask one of the components of the Minimod tool, which is the economic optimization model, to actually identify the most cost-effective collection of interventions that effectively cover at least as many kids as the business as usual. And no cheating allowed, in the sense that we know that some of these programs, in fact, the vitamin A supplementation program in 2009, performed fairly well in the north, less well in the south. and even less well in the cities. But those are the programs that existed, and those are the ones we'll include. So what does the economic optimization model suggest that we do? Well, first, it suggests that we actually invest in improving the fortified cooking oil program and develop a bouillon cube, even though in the first 3 years of this bouillon cube program, there are no benefits generated. The second thing is it suggests that we focus vitamin A supplementation in the north, where the problem is most severe and where the cost associated with doing so is lowest. It suggests that we do not engage in the vitamin A fortified maize program, in part because children eat very little, and in part because the vitamin A delivered, the amount of vitamin A delivered in maize is actually pretty small. So the good news is, the very good news is that the total number of children that are effectively covered by this new collection is actually greater than the business as usual, and the cost per child effectively covered is down to about 71 cents. So $2.49 versus 71 cents per child year effectively covered is, by definition, doing more with less. But none of these programs can be done immediately. The model tells us we should jump from one situation to another. We know that's not possible in reality. There are technical and legal issues to be addressed. All these transitions require investments, and these take time. And vitamin A deficient children need to be protected during these transitions. So we use the tool then to explore one path. Let's invest in the economically efficient solutions that have been identified by the economic model, which is to improve the oil fortification program and get going with the vitamin A fortified bouillon cube. And we need to protect these children by continued vitamin A supplementation during these transition periods, according to the GAVA framework. So here's what happens, and this is going to be a region-specific or macro-region-specific view. This is in the South, where we begin with about 20% of kids with inadequate intake. We improve the oil program, and then we introduce, by year 4, the fortified bouillon program. And in doing so, we actually reduce the prevalence of vitamin A deficiency or inadequate intake to below what is considered a public health problem. Another way of looking at this, and these are numbers of children whose lives are saved, and we generated these in collaboration with the LIST team. The solid line is the lives saved by food fortification. The dotted line is lives saved by food fortification plus vitamin A supplementation. What you can see is that by year 4, the marginal contribution of vitamin A supplementation to lives saved is very small. So in a case like this, the fortification programs can solve children's vitamin A deficiency problems in the context of the South. When you go to the North, however, you get a different story. The prevalence of inadequate intake is much higher. The 2 fortification programs still make a huge contribution to reducing this, but the reduction is never to the 2.5% WHO fortification guidelines cutoff for public health problems. And in this case, the vertical distance between the lives saved by the fortification programs and the fortification plus VAS is always fairly large. So vitamin A supplementation will be needed. We need to continue. The fortification program, in this case, cannot solve the problem. It can reduce it, but it cannot solve it. Finally, the Minimod tool gives us some insights into the cost savings associated with these over the 10-year period, including one validation study. Okay. Now, let me move quickly to the Uganda case study. Here, we're comparing community-based versus facility-based platforms for delivering multiple micronutrient powders to young children. And this is done in the Namatumba County of Uganda. One of the first things we do when we do these cost exercises is basically tally all of the supply chain costs, starting from the purchases from DSM or whoever, all the way down to the final delivery point. And again, these costs might not be interesting to everybody, but somebody has to pay them, so you should include them in your models. Our primary interest was down here in the last mile, where we had two options. One was to use the health center Sometimes these health workers, actually the clinic staff actually went out and did some outreach to the populations. Most of the time, the population had to actually go to the health center to get their multiple micronutrient powders. The other platform was to have VHTs, the village health technicians, actually be the go-betweens and spend their time and effort making sure that children or the households actually receive these. When you do the complete math on this in a scaled up version for the entire district for 3 years, what you get are two multicolored histograms. And the colors are really important because what they do is they identify all the different activities that must be included in delivering these multiple micronutrient sachets. You'll note that the difference between the facility arm and the community arm are quite significant, and we'll get into that in a second. What you'll also note is that the product costs and the procurement costs are very large drivers of costs. But the last mile costs loom large as well. And these are mainly comprised of opportunity costs of what both the participants in the delivery mechanisms as well as households have to face in order to actually participate effectively. And the training costs are very high as well. Now, one of the things we're going to preach is be careful of your, or be thoughtful regarding your indicators of success. Is if you're just comparing across program costs here in this case, then it's pretty clear everybody wants to sign smaller checks. However, when you start normalizing these costs, however, by the first indicators of success, which would be the numbers of sachets distributed, then in fact, you get a flip-flop. Is that what we have is the numbers of sachets delivered was much, much higher in the context of the community than in the facility arm. And therefore, the cost effectiveness, okay, by this metric, is very significantly different. Okay, we have 47 cents per sachet and 22 cents per sachet for the community distribution. And this you should reflect on, the folks who kind of stand up and shake a sachet and say, hey, 2 cents, we can actually solve a problem for 2 cents. That is a small part of this. It actually costs up to 10 times more in the context of this study to deliver these relatively expensive sachets. Okay, now I want to talk a little bit about the scaling up scenarios. And remember that you have to be very clear about what you mean by scaling up and who is going to be doing the scaling up. You can have the implementing partners do the scale up for you, perhaps paying the VHTs, perhaps not. You can have the Ministry of Health take over and perhaps paying the VHTs or not. Or you can integrate, or you can try to integrate these programs into existing programs, the IYCF programs, for example. Whenever every one of these scenarios, the input-output relationships can be slightly different and the price weights can be different as well. So you get different estimates of cost and cost effectiveness, and I'll show you that in a second. And here are some measures of, or some reported measures of cost effectiveness. This is the scale up for the implementing partners. For first, the essentially managing inventories. What is the cost per packet distributed? And what you can see is the facility arm is much more expensive than the community arm, as you would expect. But one of the big takeaway messages here is if you become more insistent in terms of your definition of success, and you want actually to know how many kids are eating these and how frequently and in what quantities, and take that into consideration, then you get a very different answer to the question how cost effective any of these distribution mechanisms are. For example, this is the cost per child reach, where the definition of reach is, did this child take at least one of these micronutrient sachets in the past week? And here you move from $6.48 to $52.66. If you increase, again, your demands in terms of metrics of success to adherence to protocol, then the costs go even higher. And so one of my core messages here is that the community arm, of course, is turns out to be more cost effective. But all of these platforms are going to be expensive in terms of adherence to protocol. And this means that we need to pay more attention to the last 3 meters. And the last 3 meters are getting from the distribution to the household into the mouth of the child. They are on the shelf in the household. They're not getting into the child's mouth with the frequency and quantity that they need in order to move the needles that we like to see move in terms of biomarkers, for example. Very quickly, what we have now is you can have different groups taking over, and you will get different answers to the question how effective and cost effective these different combinations of actors might be, including the integration one. But the same patterns occur, and it's that it's relatively cheap to deliver these things to the area, perhaps to the household. It's much more expensive to actually do so in a consistent way that is going to change your outcomes. And one final slide here. This is a colorful one because I want to remind you that all these colors matter. Even these small ones, the small green ones, monitoring and evaluation, that's pretty cheap, but it's absolutely fundamental. If you do not do this, then your program will not perform to your expectations. The second thing I wanted to show you is the integration, as it is very common once we identify these products that we want to have delivered to children to imagine that, well, let's just give it to people who are already doing something with women of reproductive age or pregnant lactating women, and they can do it for us. And you imagine that that's going to be almost costless. Well, first, you still have to buy these things, and there are millions of these sachets that need to be purchased. And then you also have to deliver them. And these deliveries are not going to be free. And so my second bottom line here is that program integration can reduce the costs, but they will not eliminate them. Okay, I want to say thank you on behalf of the Minimod team, which is a huge group of individuals who developed the databases and the tools for the Cameroon cost effectiveness presentation that I just gave, and the Spring project team that did the very heavy lifting associated with collecting data, doing the analysis associated with the trial of alternative distribution platforms for micronutrient, multiple micronutrient powders. Okay, with that, I will stop and chase me if you need me. Thank you very much.
Thank you, Steve. We really enjoyed the introduction to the Minimod tool. And it was great to have two really concrete examples from Uganda and Cameroon so that we begin to understand the benefits of that model. From here, I'd like to introduce Dr. Omar Dari. Dr. Dari is a health science specialist for nutrition with the Bureau for Global Health at USAID. We all know Omar's well-established expertise in micronutrient assessment and food fortification, and he's going to share some thoughts with us related to the costs and benefits associated with food fortification. Over to you, Omar.
Thank you, Heather, and good morning, and good evening, and good night, everyone. I have been working in food fortification for 30 years. During all these years, I constantly see proposals to support food fortification programs in the order of $1 to $2 million per year, and for several years, for countries whose yearly fortification programs should be within that amount. Then the question is, if food fortification is highly cost-effective interventions, as we usually hear, why is this implementation so expensive? On the other hand, I have been involved in the introduction of many national fortification programs, and we have been able to implement them with very small investments through the collaboration with the local industries. And the programs are still running in the absence of any international aid. Then what are the reasons of this difference? I will try to explain some of them in this talk. The advocacy for food fortification is nothing new. The project PAN used in this promotional material 26 years ago the following statements. Food fortification resolves many issues of equity and access because it's population-based, and the fortification of staple foods reaches those most vulnerable to nutritional deficiencies. And another one, food fortification is also cost-effective. More recently, 14 years ago, the good colleague Jerry Haas published a paper that included this statement. Among the several proven approaches available for addressing the problem of micronutrient malnutrition, fortification is currently the most cost-effective and sustainable. He is not alone. Many more colleagues have used similar phrases. In the current website of GAIN, one can find the following assertions. One of the fastest and cheapest strategies to reach hundreds of millions with improved intakes of essential nutrients is through food fortification. And another one, food fortification has been ranked among the top 3 international development priorities by the Copenhagen Consensus. However, the caveats for food fortification works are frequently missed. All the claims that I have presented are valid only if fortified foods are produced by formal and centralized factories, only if increments in the cost due to fortification are incorporated into the price of the product. Otherwise, someone needs to subsidize everything, as for example, a governmental support social program, and only if reliable, efficient, and low-cost enforcement systems ensure a level playing field. First, we need to recognize that mass fortification is an opportunistic intervention. It means that it takes advantage of an already existing product and its delivery system, the fortifiable food, which is a staple of our condiment manufactured by the formal industry and consumed by vulnerable populations. Food fortification does not need to create a new product nor requires changes of behavior. In this slide, I am comparing food fortification with supplementation programs, including MNPs. Coverage is high in food fortification and very low in supplementation. Cost of micronutrients is lower in supplements because the micronutrients are better protected in them. However, in supplements, the cost of other things beyond micronutrients are 30 to 30 times more expensive. For example, in the case of MNPs, the cost of the micronutrients is only 5 to 10% the cost of the product. The rest is the envelope, that means the sachet and the packaging. Fortification, on the other hand, if well implemented, only requires an additional cost of 10% for financing the new equipment and the quality control practices. Cost of delivery is negligible in fortification, as a system of distribution already exists. While in supplements, it can be 2 to 4 times higher than the cost of the total of the product. The cost for supplements does not end here. It is important to convince the population to use the supplements, and this requires expensive social marketing. In summary, supplementation programs can be from 5 to 100 times more costly than fortification. However, and this is important to keep in mind, fortification must prove first to be viable. And for this, in addition to the involvement of formal industries, national enforcement and monitoring systems should be introduced. If mass fortification is feasible, the investment is very logical. This table illustrates the theoretical combination of fortification of salt, oil, and wheat flour. As you can see, iodine, vitamin A, vitamin D, folate, and B12 can be provided nearly to 100% of the estimated average requirement. And iron, zinc, and other vitamins of the complex B between 30 to 60% of the EAR. The yearly investment per person is going to be 1 cent, 5 cents, 20 cents for each one of these commodities, for a total of 26 cents per person per year, which was 1 sachet as calculated by Steve in his previous talk. This column of this table shows the absolute total cost of this fortification example for a country of 10 million persons. It is a total investment of $2.66 million per year. The question here is, who pays this? It is not usually the government. It is not the industry either. It is almost always the consumer, because the industry transfers the cost of the fortification into the price of the product. If this is not allowed, then there is a problem. Although these amounts seem to us low, if the cost of fortification is not transferred into the price of the product, the industry is in difficulty because these are deductions from the profit. The food manufacturers need to increase sales from 10 to 20 times these total amounts, assuming profits from 10 to 5% respectively. This is why fortification of staples depends on the existence of a reliable government system to avoid an unfair competition of some industries that may be tempted to cheat. The industry is not full. They may be willing to collaborate for social objectives if that does not put at risk their profit. Here is important to point out that the argument that the industry may increase sales if adopted fortification is not applicable because these are staples. And in addition, for health reasons, we don't want that the consumption of these food vehicles increases. Notice that I encircled in yellow the yearly investment of 1 cent to provide all the iodine that is needed for an adult for a total year using salt as the vehicle. Some years ago, this cost was estimated at 5 cents per year per person. This amount continues sounding low, but is 5 times higher than the one I'm showing here. Why was that? Because at the beginning, we tried to introduce salt iodization under conditions that were inappropriate, mainly because in many countries, salt is produced by thousands of small and simple operations. In addition, many expensive promotional campaigns were launched and that were omitted. After so many years of trying, we have realized that food fortification should be implemented by reasonable, well-developed industries. Despite of that lesson, we don't want to learn. We continue motivating countries to try fortification in small industries, and we have even developed equipment for this purpose. This table compares the cost conditions of trying to implement fortification in medium-sized maize mills in Uganda against small factories. The table says large mills, but indeed they are small as compared with wheat flour operations. It is clear that the cost of scaling up fortification at small factories, regardless the relative low cost of the equipment, is going to be a large investment. And this is only for covering 44% of the national demand of flour. If we add to this the requirement of governmental inspections, instead of 60 visits per year for 2 visits per factory, 930 will be needed for 1 visit per year to each one of these small factories. If countries have limitations to keep inspection to formal industries, how they are going to deal with products manufactured by thousands of small producers? This is impossible. The small food industries fill important social roles, but fortification is not included among them. We have introduced another complication in food fortification in developing countries because of our insistence of using quantitative assays to do quality control. This figure shows the quality control operations of a wheat flour mill in Guatemala, which is 10 times larger than the largest maize mill of Uganda. If you see the label of the horizontal axis, it says the weekly samples. That is correct. 2 samples per week. That is sufficient. This mill uses qualitative testing along the day to check that the product is being fortified, but quantitative assays are reserved only for documented compliance using a daily composite sample. That is the mix of single samples taken along the day in only 1 sample. You may think this is not sufficient, but worldwide, this is the normal practice in the industry of staples. This table shows the nutrient composition of a type of enriched flour in the US as presented in the USDA food composition table. The results come from the analysis of around 27 composite samples. This is correct, 27 samples, and no one has questioned these results so far. Even more, they have been adopted by many countries in their own composition tables. Then why in our population surveys to assess the contribution of food fortification programs, we're taking thousands of samples at the household level to estimate if each single sample is complying with the standard of the country? The only parameter of interest is the average content of the whole supply along the year and not the distribution of values. We have classified many food fortification programs as failures based on the proportion of samples at household level that not comply with the national standard, instead of calculating what is the additional average supply of the micronutrient through these means. This has been a waste of resources. Based on the results of this table, I estimated the percentile fifth of the data seen in those composition tables in order to look how many of them comply with the minimum content requested in the standard of the USA, which is presented in the last 2 columns of the table. For all the micronutrients, I estimate that around 1/3 of the samples have micronutrient contents lower than the specified minimum. Is this bad? No, this is normal, as the current standards were made assuming contents within ranges that are not reflecting the reality of the process. This is a problem at a global level. This program in the US is providing nutrients in good amount to the population. This figure illustrates my prior point. The distribution of values around the mean is going to change depending on the sampling scheme. Narrow if we use composite samples per day, that is the blue curve. A little wider if composite samples are per batch, this is the green curve. And very large if we use single samples are analyzed, those are the red curves. If compliance is judged by a minimum value, that is the black vertical dotted line, the classification of the performance of the program is going to change depending on the type of the samples that we have used. But the average continue being the same. Therefore, the main parameter to judge the nutritional contribution of a food fortification program is the average and not the distribution range. The latter is used for quality control, not for epidemiological purposes. Accepting this concept will improve the appreciation of the importance of food fortification in many countries. Let me finish with one more point. What if there are not suitable factories for introducing mass fortification? Well, look for another intervention. What about using parboiling for rice fortification? Parboiling is a millenary practice of pre-cooking rice to make the grain less hard, which is in dry areas of the world can destroy the milling machines because the rice grains are like rocks. After pre-cooked rice, it is dry, and then as a softer grain, it is milled. This is the parboiled rice. Parboiling has the advantage that the soluble vitamins, such as the vitamin B1, B6, and niacin, which are present in the bran, this is the germ and the aleurone layer in the grain, which is in the figure in the right and in the middle. Those migrate to the endosperm. The endosperm is the slight yellow color in the figure. And as a consequence, the content of these nutrients, which are presented in the graph into the left and bottom, in the orange columns in the middle, is similar to those of the brown rice, which are the columns at the back of the figure in the brown color. Regrettable, the minerals do not migrate. And in the case of the white and polished rice that is not parboiled, the bran is removed. And therefore, a good proportion of the micronutrients that are presented in the whole rice grain are lost. Those are the values that I presented with yellow columns at the front of the figure. A few years ago, some colleagues thought that if we add soluble zinc to the water of parboiling, it will migrate to endosperm, and so the rice will be fortified. They did the experiment, and indeed, the zinc content of the parboiled rice increased twice from the original content. We can think that it was a success, but not too fast. We need to do first a cost efficiency analysis of this process. The mass balance analysis of zinc added for parboiling is present in this table. You can see how the different fragments of the rice absorb the added zinc. The meal rice received less than 1% of the total zinc use that appears in the red font. As a conclusion, this was an attractive but a naive idea. It was not only inefficient and expensive, but also a source of contamination for the environment. In conclusion, it was fine to try, but at the end, it was not a good idea. And hopefully, this study is going to be published for preventing others to repeat the same mistake. In conclusion, for interventions in public health nutrition, one needs to be simple, practical, realistical, and logical, and really evidence-based. Population coverage, feasibility, and low cost have priority over good intentions. Mass fortification has important role in public health nutrition if the conditions are appropriate. And those are that the fortified food, that means manufactured by developed industries, are consumed in reasonable amounts by the vulnerable population. If food fortification is implemented in a few centralized food industries, is the possibility of incorporating the cost of the fortification into the price of the product is real, or that social programs are going to assume the cost. And there are national, reliable, and efficient enforcement monitoring systems. If the conditions are not adequate for mass fortification, then we need to think in other interventions. We need to look in the promotion of really micronutrient-rich foods, starting with animal source foods that have been the natural source of many micronutrients for humankind for thousands of years. And also, we can try biofortification for some nutrients, and we are going to see in the next talk. We also could consider the production of specialized processed fortified foods for targeted fortification. Those are the programs using humanitarian aid and social programs and part of the complementary foods. Because these foods, in addition to the traditional micronutrients, can also deliver essential amino acids and essential fatty acids. And we need still to keep in mind the use of micronutrient supplements for targeting specific groups for supplying the micronutrients that continue being insufficient in the diet of these groups. But those nutrients could be different from country to country. Supplementation programs at the national levels are always expensive, but they are justified if there is no other alternative. However, countries should be aware that in addition to the cost of the micronutrient supplement, they should also budget from 2 to 10 times more to cover the implementation cost. Thank you, and I hope that I gave some provocative ideas for your own reflection.
Many thanks, Omar. What a great reminder and some really clear guidance for us for considering cost effectiveness of large-scale food fortification as a part of an overarching micronutrient intervention strategy. I'd now like to introduce Keith Levidny. Keith is head of the Strategy and Policy Research Unit of Harvest Plus at the International Food Policy Research Institute. His research is focused on how agriculture, international food trade, and the food system contribute to nutrition security and the role of large-scale nutrition interventions, such as biofortification and fortification, in addressing remaining nutrient gaps. Over to you, Keith.
Well, thank you very much for your introduction, Heather, and good morning, afternoon, and evening, everyone. As we all know too well, the burden of micronutrient deficiency and disability-adjusted life years, or DALYs, has become increasingly concentrated in Africa and South Asia, as calculated by the Institute of Health Metrics and Evaluation of the University of Washington. Annually, the hardest hit countries lose the equivalent of thousands of years of life. In addition, a number of factors are exacerbating these conditions. For example, the COVID-19 pandemic has resulted in negative impacts on health and nutrition all over the globe, as we've heard this week. And many studies are now demonstrating the additional negative effect climate change has on nutrient availability. So over the last 2 decades, biofortification has begun to emerge as an additional intervention in the toolbox to address potential nutrient gaps at different points in the food system, along with industrial fortification and micronutrient supplementation, particularly when other dietary diversification strategies are not immediately possible. Biofortification is simply about remembering that the nutritional quality of the plant is important when breeding new varieties, and so aims to increase the density of vitamins and minerals in the plant as new varieties are developed each year. Several subclasses of biofortification exist, as we know. However, this presentation will focus on conventional, that is non-GMO breeding methods of biofortification. Biofortification breeding programs have largely been funded as separate programs from other ongoing and/or specialized breeding programs that focus on productivity. However, biofortification breeding does not only include nutrition traits. A set of non-negotiable core traits shown here in the center must be bred for, including yield and climate adaptation, along with nutrient content. However, the reverse is not necessarily true for other breeding programs. Breeding for nutrition is currently not part of the core set, as you can see. The goal of mainstreaming biofortification in breeding is to move the nutrition traits into this core for a larger proportion of breeding programs. Progress toward this goal will help ensure the sustainability of the intervention and help realize its potential at full scale. Recognizing this, traditional donors of biofortification breeding programs are beginning to fund the mainstreaming of biofortification throughout the greater CG consortium to include nutrient traits as part of a greater percentage of core breeding programs. So with that as a backdrop, questions remain about where best to invest in biofortification to inform scaling. To conduct cost effectiveness analyses, we need comprehensive data on both the benefits and the costs of biofortification programs. The core database of this study used to quantify the benefits is the Nutrient Balance Sheets, or NBS, a database I developed as part of my doctoral dissertation work at the Friedman School of Nutrition Science and Policy of Tufts University. The NBS uses the food balance sheets for its core data and further integrates essential information made available by a number of institutions referred to down here. Using the NBS allows us to examine the potential of biofortification within a food systems context, taking into account important dynamics such as the supply from domestic production, both losses and contributions from international trade, cereal processing, post-harvest loss, and retail and household waste. To calculate impacts for cost effectiveness analyses with the NBS is linked to DALYs from the IHME. So what does it mean to use DALYs as a measure of impact? We can see here that iron, vitamin A, and zinc deficiencies are causes and/or risk factors for a number of adverse health outcomes. DALYs translate the effect of these diseases on both mortality and morbidity into equivalent years of life lost in one single metric. So when we use the DALY as a measure of impact or benefit in these calculations, we are examining the effect of the intervention on saving years of life from these diseases. So are there any additional diseases that should be considered? Well, one area of current investigation involves the potential role of zinc in non-communicable disease outcomes, or NCDs. A meta-analysis by Pompano and Boyd published this year in 2020 found that zinc supplementation, particularly when given in low doses and long duration, significantly reduced levels of several intermediate risk factors for NCDs. This suggests that small increases in dietary intake over a long term may improve metabolic health. So we screened IHME's database for these metabolic risk factors and their contribution to disease burden, and found that both high fasting blood glucose, or FBG, and elevated LDL cholesterol are risk factors for a number of diseases shown here. FBG and LDL play a contributing role in these diseases, and so by affecting the level of FBG and LDL, we can potentially help reduce a portion of the burden from these outcomes. Finally, by considering the average effect sizes of zinc supplementation from the Pompano and Boyd study on the changes in levels of FBG and LDL as the ceiling of what zinc interventions can achieve, the effect from biofortification was calculated as a proportion of this change on the amount of daily zinc, based on the amount of daily zinc delivered. Now, cost data come from Harvest Plus budget and expenditure data for targeted biofortification breeding and country delivery programs. For breeding, the costs of crop development programs, research training, genomics, and equipment were included in this analysis. Delivery costs include those for awareness raising and marketing, trainings, any free goods and incentives, costs of seed production and field expenses, delivery-related salaries, local transportation, and pass-throughs. To develop cost models, the costs of breeding and delivery were first tabulated for each country separately through the current year. Aggregate annual delivery cost data were then combined with monitoring data collected by Harvest Plus to develop unit delivery cost per farmer reached, which were multiplied by annual adoption under different scaling scenarios so that total delivery costs were related to the magnitude of scale examined or assumed to be achieved. Now, future breeding costs were also based on current annual breeding costs and assumed to change by 5% per year. In mainstreaming scenarios, progress toward mainstreaming was factored in a cost adjustment so that incremental costs were included. So given the focus on zinc and the potential to address the double burden of malnutrition, I'll now present results for zinc wheat and zinc rice. This slide presents results for zinc wheat. NBS data were used to inform the current situation and potential with biofortification of domestic production when further combined with data on breeding targets and from nutrition studies. Before turning to the cost effectiveness results, here we are looking at maps showing the maximum annual DALYs that can be saved with biofortification at full scale. We show this only as a point of reference to indicate where biofortification can be most impactful. This can help guide priority setting and further analysis. The top figure shows the proportion of annual DALYs saved related to zinc deficiency, categorized into quintiles. while the lower figure relates to diseases for which FBG and LDL are risks, referred to simply as NCD-related DALYs. Now we see that the highest proportions saved are observed in South Asia for both types of DALYs saved. The maximum percentage approaches almost 60% for zinc deficiency DALYs, while for NCD DALYs, the maximum percentage is much more modest, as you can see, approaching 17.5%. This next slide now offers the same layout for zinc rice. We see the highest proportions saved are observed primarily in South and Southeast Asia now for both zinc deficiency and NCD-related DALYs. The maximum percentage of zinc deficiency DALYs saved approaches almost 90%, whereas the maximum percentage of NCD DALYs saved approaches 48.5%. So we just saw that countries in South Asia may benefit greatly from either zinc wheat or zinc rice interventions. Therefore, for the cost effectiveness, we'll take a closer look at zinc wheat for Pakistan and India and zinc rice in Bangladesh. So here we have total annual zinc deficiency DALYs on the left and NCD DALYs on the right. The status quo is in blue, and DALYs with either zinc rice or zinc wheat are in red and green respectively for Bangladesh, India, and Pakistan. On the left, we see that Bangladesh experiences far fewer DALYs related to zinc deficiency than India or Pakistan, of about 40,000 per year. The scale on the y-axis on the right is 50 times that of the figure on the left. So while the potential for reductions appear modest, as you can see here, because of the scale, the potential to alleviate substantial disease burden is still high. When looking at the percentage of DALYs that can be saved shown here, the impact of zinc rice in blue is greater than zinc wheat in red in Bangladesh. We see the flip of that in Pakistan, where zinc wheat is greater and the potential for large impacts, from both staples in India. For NCDs, in Bangladesh, about 38% of NCD DALYs can potentially be averted with zinc rice. In India, 10 to 15% of these NCD DALYs can potentially be averted with either crop, while in Pakistan, about 17% can potentially be averted with zinc wheat. So as we move to the cost effectiveness results, I want to give you a feel for the adoption and cost profiles that were examined. So adoption curves are shown here on the top row. For each country, a high adoption scenario shown in red was examined that factors in a hypothetical progress with mainstreaming of biofortification in breeding. It has a higher adoption ceiling of 95% and faster rate by which it achieves that ceiling. A second, quote, no mainstreaming scenario assumes a ceiling of about 45% with also a slower rate of adoption. These scenarios were further split into relatively higher and lower rates of unit cost reduction over time for delivery, as shown in the bottom table in the second to last column on the right. Now, the cost profiles are linked to the adoption scenarios on the previous slide. So you can see here that breeding has large upfront costs in the early years of varietal development. Once the efficiency of breeding increases through additional innovation and in the establishment of first wave breeding lines, costs decline over time, with the rate depending on the contribution from mainstreaming over time. Now, delivery costs are minimal in the first years prior to first wave releases, as you can see here. But once delivery begins, delivery costs become much more intensive to promote seed replacement and adoption of the new varieties. Now, there is greater uncertainty around how delivery costs continue to play out from this point forward. So if great progress in mainstreaming is achieved, the rate of seed replacement and turnover in developing countries is expected to increase. However, if mainstreaming lags, delivery costs could remain intensive, reflected by this large red arc in the middle bottom graph for scenario 3. This is also reflected again in the unit cost of delivery shown on the right. The unit costs begin around $10 per farmer, but are expected to fall to only a few cents per farmer. However, the rate of this decline in unit costs will impact the aggregate delivery cost needed to drive adoption annually. So how does annual potential translate to cost effectiveness according to these profiles? So the current threshold for what the World Bank considers a highly cost-effective health intervention is currently $270 per DALY saved. Results here are presented by scenario and either with or without NCD-related DALYs, as you can see. The first two scenarios with mainstreaming are highly cost-effective without considering NCD DALYs saved, with cost effectiveness ranging from $9 to $140 per dolly saved, and benefit cost ratios ranging from 7:1 to 111:1. With NCD dollies saved, the cost effectiveness increases dramatically, as you can see, ranging from 79 cents to $2.78 per dolly saved, and with benefit cost ratios ranging from 360:1 to 1,265:1. Now, in scenarios 3 and 4 without mainstreaming, cost effectiveness ranges from about $23 to over $600 per dolly saved in the most pessimistic scenario in Bangladesh that does not have NCD dollies saved. The effect of many fewer dollies for zinc deficiency really drives this, as we saw before in Bangladesh, with the more intensive, along with the more intensive delivery costs that we use for scenario 3. However, the intervention is still cost effective with benefits of about 1.6 to 3 times that of costs, and highly cost effective in India and Pakistan with benefit cost ratios ranging from 10:1 to 43:1. And finally, with NCD related dollies saved, the cost effectiveness ranges from $2 to $12 per dolly saved, with benefit cost ratios ranging from 83:1 to 489:1. So in summary, analysis of biofortification with zinc in South Asia indicates the potential for high cost effectiveness. An important component of this is the potential for zinc to address the double burden of malnutrition, but of course, more research is needed into this new exciting area. By starting with broad-reaching staples, biofortification can have wide impact, even if scaled only through domestic production, as was examined here. Next, since biofortification always includes breeding for core non-negotiable traits such as yield and climate adaptation, agronomic benefits should also be quantified where applicable. For example, if the program offers yield gains over and above currently grown varieties, as has been observed for iron beans in Rwanda. Mainstreaming and international and national breeding programs can help biofortification become a more sustainable, cost-effective tool to address micronutrient malnutrition. And as mainstreaming increases, cost-effectiveness analyses should continue to track and consider these incremental costs in the programs. And of course, coordination with additional interventions and public health strategies is necessary. And when considering these multiple interventions, the dynamics of geographic and temporal scaling, as well as the incremental cost effectiveness, need to be considered, as we've already heard from Steve. And finally, as the new data on both the impacts and costs of biofortification continue to become available, specifically for delivery costs, these should be incorporated into updating future analyses. Thank you very much.
Thank you so much, Keith, for helping us to not only understand biofortification a little bit more, but also for introducing the nutrient balance sheets for analyzing the contribution of biofortification as part of a broader fortification strategy. So some great analysis there, thank you. So with these 3 excellent presentations to consider, I would now like to introduce Dr. J.V. Meenakshi. Meena is a professor at the Delhi School of Economics, where she teaches courses in econometrics and food and agricultural policy. Meena has agreed to bring her background and experience to a few reflections on dilemmas that policymakers face in choosing efficacious interventions. Thank you so much, Meena, for sharing your insights with us.
Thank you very much for inviting me to this. And I must say it's a hard act to follow the 3 presenters that have just gone on before me, but I'll do my very best. What I'd like to do is to get started with just reflecting on a conceptual framework that I think we all have in our minds when we're looking at micronutrient interventions and think about questions related to cost effectiveness. So what we have at the very basic level is a sense in which we have either in countries or communities or continents, a notion of there being adequate supplies of macronutrients, however we choose to define them, either through the nutrient balance sheets that Keith mentioned, or whether we talk about closed economies or economies that have access to trade or are dependent on trade for much of their food. And there's a sense in which that these supplies of macronutrients somehow translate into household dietary adequacy, And in this, I'm subsuming what Steve had referred to as the last 3 meters, that it also translates into an individual child having access to an adequate diet. And finally, we then believe that these diets, once diets have improved, that this in turn will translate into better nutritional outcomes. And yet we know that this simple pathway is far from being an adequate representation of what actually happens in most situations. The first thing is that there are several leakages. This pipeline, if you like, can have several leakages. There has to be a question of market access, whether even if the country has access to these supplies of micronutrients, whether actually households have them or not is a specific question. There are questions about hygiene and whether even if there's dietary adequacy, whether that translates into nutritional outcomes may depend on sanitation, may depend on concerns of food safety and spoilage. It also may depend on whether there is equitable allocation of nutrients within households, whether the households have access to safe drinking water. And the kinds of interventions that we're looking at in this set of talks is one component of a much larger food system. And all through this pipeline, we have to have, as Omar mentioned, we have to look at whether there is in fact a supporting policy environment, whether that is in the form of price incentives, which encourage the consumption of so-called healthy foods or perhaps discourage consumption of unhealthy foods, including in fact, whether there are governance structures to make sure that what we believe is augmenting the supply of micronutrients is in fact reaching households and then translating into better nutritional outcomes. And at the same time, there need to be supporting data systems in place that allow us to look at this entire chain and examine where the leakages are and where they need to be plugged. However, given the focus of this session, I'm going to focus only on micronutrient interventions and also talk about some of the takeaways that I have from having read some of these presentations earlier. So what all three have in common is the notion that, of course, we all know that micronutrient deficiencies are widespread, but that they affect different target populations to different degrees, even with a country. And this depends on whether you're talking about vitamin A or whether you're talking about iron, whether you're talking about zinc. And that a multiplicity of interventions are often necessary. One size does not fit all, where the multiplicity of interventions is necessary either because the degree of micronutrient deficiencies vary across age groups, across gender, or across region, as Steve pointed out in his work on Cameroon. And a one size sort of notion will clearly not fit all, at least even in a country context. So given a metric of benefit at the population level, and we've seen different metrics being articulated in all the three presentations, the most efficacious interventions may not necessarily be the most cost-effective, nor may it be practical. This came out most clearly in both Steve's presentation as well as Omar's presentations. However, what all have in common is a focus on ex-ante modeling, so that we know that these are exercises which allow us to conceptualize what the trade-offs are and enable us to design context-specific priorities for investments. So I want to now focus on what the ex-ante analysis, some lessons that I have learned at least from these presentations on what ex-ante analyses can demonstrate, and maybe focus on aspects that the presenters haven't necessarily elaborated on given the time constraints that they were operating under. And the first is perhaps obvious, but nonetheless important to state, which is that ex-ante models are only as good as the assumptions that are made, and this is acknowledged by all presenters. The point is that this can be turned into an advantage because ex-ante modeling can be used explicitly to do scenario analyses and to say what key components of changes in assumptions would lead to a much altered portfolio of interventions to address micronutrient deficiencies that we could recommend to, let's say, governments or other stakeholders. A second notion that I think could deserve greater attention is that while we recognize that waiting for the long run is not going to work, there are certain differences by time horizon, say between the short run and medium term, and ex-ante analyses can actually effectively demonstrate how portfolios of interventions may change depending on whether we're looking at the short term of the next 3, 4, 5 years, or over the medium term, and indeed over the extremely short term, as the recent pandemic and the dislocation that it has done, both in terms of livelihoods and in terms of access to food, have demonstrated. So these ex-ante models, I think, have a utility far beyond what has been demonstrated in these previous presentations. The main takeaway for me, however, is that it's important that we don't look at these ex-ante tools as being static and model-driven analyses, but rather that we use them to factor in, ideally in real time, changing evidence on effectiveness and cost and its implications for the mix of interventions that we recommend to policymakers. And I apologize for the typo here. It's any changing evidence on effectiveness and cost and their implications for the mix of interventions that we might want to consider or to advocate. So to elaborate on that a little bit more, I'd like to basically pick up where Omar and Keith in particular were referring to, which is that we have a notion that of ex-ante analyses that inform decisions on interventions, and hopefully these are rolled out. And then they translate into ex-post impact of what we want to see in terms of nutritional outcomes. And all along, there is a monitoring and evaluation system that allows us to say that indeed this mix of interventions does in fact lead to these improved outcomes. And the monitoring and evaluation costs, as we noticed from Steve's presentation, those little green bars, are actually not that large a component of the cost, but actually are critical to achieving adequate impact. However, I would suggest that it's important not to look at this as a unidirectional pathway from ex-ante analyses leading to a set of interventions which is context specific and then in turn leading to outcomes in terms of reduced micronutrient deficiencies, but rather that the monitoring and evaluation systems be used as a critical part of a feedback mechanism by which the costs can be updated because there may be hidden costs or costs that were not anticipated by the modeler. So we are able to update the cost side of our ex-ante analyses. And at the same time, when we have ex-post impact assessment, we're also able to update information on benefits and use that to feed back into our ex-ante analysis. In other words, the ex-ante analysis should really be viewed as a dynamic process and one that responds to changes in the evidence base, be they on the cost side or be they on the benefit side. So by way of takeaways and ways forward, I do believe that one lesson that at least I have learned from listening to these three presentations is that the additional resources for integrating and recording cost information into monitoring and evaluation systems are small, certainly relative to the gains that are to be had when we are able to better target and to in fact engage with better decision making. The second point I wanted to note is that effectiveness results are often small scale, and that sometimes discourages us from making more, if you like, larger statements about the potential benefits from the micronutrient intervention mix that we're advocating. However, there is a way to engage with other data systems which do monitor and track indicators at scale, such as the Demographic and Health Service, for example. And the monitoring and evaluation systems that are set in place can be used in conjunction with other sources of information to provide what in the economics literature is known as causal estimates of impact, so that you're able to, if you like, build up from microdata to make plausible statements about what is happening on scale. And with the focus on data systems, on big data, this is becoming increasingly easier to do, and in my view, is something that the micronutrient world can take on far more easily than perhaps has been envisaged. This is certainly something that the agriculture world has started to do recently, and I believe that there are win-win possibilities in such kinds of integrations. But of course, these have implications for data needs going forward, and in particular, that there be a commitment both across national and international statistical systems for ensuring that these feedback mechanisms are in place, and with data costs are declining, what seem like challenges are in fact opportunities. I'll stop there.
Thank you so much, Meena. I really like the way you've laid out the ex ante to ex post route and reminding us of that feedback loop. I think it's really important for all of us to remember. I'm also excited about seeing all the range of tools and the progress that's being made in terms of opportunity for data collection to help policymakers and practitioners to analyze the effectiveness on a mix of interventions. So with all of these reflections, it seems like a good starting point for discussion. I'd now like to introduce our panel of experts who have agreed to share their thoughts on what Steve, Omar, Keith, and Meena have shared with us today. Dr. Carol Levin is an associate professor in the Department of Global Health at the University of Washington. Her research focuses on the costs and cost effectiveness of introducing and scaling up public health interventions and new technologies related to maternal and child health and nutrition interventions and vaccine preventable disease. Dr. Zia Haider is the cluster leader for the World Bank's Health, Nutrition, and Population and Global Practice in Cambodia and Lao People's Democratic Republic. Prior to joining the World Bank Group, he has worked on nutrition issues with BRAC, IAEA, GAIN, Global Health Initiative, and FAO. Dr. Jack Clift is a program director at Results for Development Institute, where he currently oversees a portfolio of projects in R4D's market shaping practice aimed at increasing the affordability and availability of critical nutrition and health commodities. Carol, I'd like to start with you. Of course, women go first. What reflections or reactions do you have to what has been presented? And as a part of your comments, what do you predict for the future use and or utilization of costing data and methodologies in nutrition? After sharing your thoughts, if you could just pass the virtual mic along to Zia and then to Jack, I'll just let the panel discussion flow without interruption. Thanks so much for getting us started, Carol.
Yeah, thank you. Good morning, good afternoon, good evening, everyone. Thank you so much, Heather, for inviting me to participate. I want to congratulate and thank our presenters for really stimulating presentations on the use of cost data to support micronutrient programs. I'd like to share some additional thoughts that are focused more on the costing per se and the use of costing data on decision-making to support micronutrient, building off of what we heard today from our stellar group of presenters. So my first point is that there are multiple uses of cost data. Today's presentation focused really on the use of cost data in what we call economic evaluation, cost effectiveness, cost benefit analysis to inform the efficient allocation of scarce resources. So the focus has very much been on the efficient use, technical efficiency, either to identify the lowest cost, to achieve a certain output or outcome, or allocative efficiency so that collectively we are using our resources to maximize social welfare or health of our populations. There really are some other super critical uses of costing to support micronutrient policy and programming, and these are related to financial planning and budgeting. Once you identify a set of effective and cost-effective interventions, as are they affordable and how do they fit into global and national budgets? Advocacy and estimating resource requirements. We often see a lot of models contributing to advocacy for micronutrients or using to project what the annual or projected over 5 or 10 years resource requirements might be to scale up. And lastly, for priority setting for new interventions, new technologies, for micronutrient diagnostics or interventions, and scaling up underutilized ones. So there are many uses of cost data. The second point is that in our field of nutrition and micronutrient, compared to other health interventions, we actually have very limited, up-to-date, high-quality information on cost per se of the full range of interventions that could address micronutrient malnutrition. And so we have to do two things. We have to increase the supply of those cost data, high-quality ones, but we also are going to have to repurpose available costing data for use in our models, for use in financial planning, for advocacy, and estimating resource requirements. So to that point, I think we're convinced that cost data are useful, but we often don't know what's included in those costs. We don't really know what they represent. We don't know if they're complete. We don't know if they're just financial costs. Are they economic or opportunity costs, which capture donated goods or volunteer time? And so again, we really do have to be thinking that how do we make cost generalizable to other settings, given that we cannot collect cost data in all settings. So again, in the short term, it would be useful to use cost for more than one purpose. The third point that I want to point out is that Steve pointed out the need to invest to make interventions more efficient. Well, what does that mean? That means that in our field, we have to be addressing both supply system constraints and mechanisms for demand generation. We need to understand all the resources along the nutrition-sensitive value chain from supply to demand. As Omar pointed out, many of the cost estimates fail to take into consideration implementation resource needs. That is, systems, be it health systems or value chains, they are not currently in place to deliver the interventions. In the short run, strengthening these systems will increase the cost of all interventions, some more than others. In the long run, those costs will hopefully diminish. So costing to date typically fails to account for these systems strengthening at scale. In addition, we fail to take into consideration the demand generation, the cost of demand generation related to behavior change communication, whether that's mass media, social marketing, community-based approaches, home visits. These are often go hand in hand with many of our micronutrient interventions, and we fail to take into consideration their costs. So what's the solution to this problem? There's a great interest to be collecting cost data alongside impact evaluations, supporting standardized cost data collection for RCTs, pilots, and implementing programs at scale would really be terrific. We should encourage standardized cost data and improved reporting of costs. And finally, I'd like to think about how limited cost data affects its use in economic evaluations, priority setting, advocacy, and estimating resource requirements. To date, we continue to focus on a very narrow subset of interventions to address micronutrient malnutrition. Why does this matter? Many of the useful and existing models that inform global and national priority setting, such as the Live Save tool list, or more recently, the World Bank Nutrition Optimum model, are not able to include the full range of approaches because of a lack of data on both effectiveness and also costs. So we aren't really harnessing the full power of economic evaluation to inform decision makings. And my parting sentence is that investing in the supply of high quality cost data, paying for cost data collection alongside implementation of programs will increase the demand for its use by stakeholders and will benefit all the purposes of using cost data, which in turn will improve micronutrient status and save lives. Thank you. Over to, I believe, there we go. Thank you.
Thank you, Heather. I would like to echo Carol to congratulate Steve, Omar, Keith, and Meenakshi for great presentations. Good evening, good morning, good afternoon from beautiful Cambodia. Let me highlight some key areas based on which at the World Bank we identify interventions that are being economically sound or cost effective. In case of micronutrient interventions, the first question we ask to ourselves, how a specific micronutrient intervention is going to contribute to a country's national development. Is the intervention going to enhance human capital formation through improving health and education outcomes? Is the intervention going to reduce stunting or chronic malnutrition? Is it going to be pro-poor or contributing to achieving the equity, gender, and social inclusion agenda, thereby promoting shared prosperity? Is the intervention going to improve labor force productivity, thereby reducing poverty? After listening to this evening's presentations and based on what we know for years, I believe nobody will disagree that each and every macronutrient interventions would nicely pass all criteria as listed above. We have no problem identifying macronutrient interventions as extremely cost-effective. Therefore, countries shouldn't have any issue implementing them at a scale. But I guess the reality is different and not so pleasant. No doubt that most countries have been struggling to mobilize sustainable financing for macronutrient programs. So the question that should be discussed, understood, and agreed, why countries have been struggling to scale up micronutrient interventions nationwide. Now let me be provocative and share a few points on potential barriers. First, based on my years of experience working in many parts of the world, I have somewhat reached to a conclusion that to date, macronutrient interventions don't have a safe home. Although we make an assumption that Ministry of Health is the safest home for macronutrient supplementation programs, or Ministry of Agriculture is the safest home for biofortification programs, or Ministry of Industry is the safest home for food fortification programs. In reality, if the respective ministers are asked by their finance minister to send a list of priorities, he most likely would leave macronutrient interventions off the list. This sounds not too pleasant, but that's the reality. I don't think we have done much to understand this piece of political economy. I don't think too many top policymakers in any country consider nutrition as a top priority even until now. Second, how much do you know about supply side barriers to scale up macronutrient interventions? Do countries have right service delivery or distribution platforms? We have to think from system perspective. Interventions have to be integrated within health, social protection, or agriculture system, or with private business, depending on what specific interventions we are talking about. You cannot continue to treat macronutrient interventions as an infant or toddler. You cannot continue to implement them in a small corner of a country. They have to grow as adults and get integrated within an appropriate system to produce results and ensure sustainability. Third and the last, demand side barriers. How many of our intended population are aware that macronutrients are needed for their healthy living? How many of them acknowledge the fact that macronutrients are extremely important for their children to grow taller, for their children to learn faster, and for their children to become productive adults? I don't think even a group of educated mothers and fathers in many high-risk countries know enough about health benefits of macronutrients. In absence of awareness creation, I don't think an effective demand for macronutrient intervention will be generated at consumer as well as political level. Not a market will be created for fortified foods so that private businesses would embrace food fortification as one of their core businesses. Thank you very much.
Thanks, Sarah. I'll take over from here then. Hi, everybody. Delighted to be back here at the Micronutrient Forum. Great to see so many friendly usernames staring back from the virtual audience. I'm very honored to share the virtual stage with distinguished colleagues and friends. Thanks to all of you for sharing insights today and for all you do on the nutrition cause. Sort of thanks to Carol for putting me in a bit of a bind here by saying a lot of the things I was going to say. So bear with me, everyone, on the kind of loosely connected additional thoughts to share here. So maybe to pick up on some of the things that have been said, I think as Steve mentioned at the start, it's really important to know not only what the costs are, but also to be thinking very clearly about who bears the costs, which I think is a really important point, an underrated point on the political economy and the equity considerations. When we think about this in terms of food fortification, it's really well established that the most sustainable option financing food fortification comes when the cost of fortification is being incorporated into the price of food, which is a feature of the program, not a bug. Perhaps as a sort of philosophical question, and without undermining the merits of fortification, should we be thinking about cost effectiveness differently when it's not money we're spending on a program, but a cost we're imposing on others, and often in a fairly untargeted way? I think related to this question of who pays, I think current methods and tools have always been very well suited to standalone programs. As we move towards these more integrated programs, as kind of Carol and Steve also talked about a little bit, it's really important to be thinking about how we can adapt tools and methods for dealing with that, and to be thinking about these questions around cost effectiveness and political economy. So while some big integrated programs may be the right thing to do, they may still not end up being feasible if the agriculture ministry is being asked to bear some cost to produce some benefit that mostly the health ministry cares about or something like that. Similarly related to integration, I also really agree with kind of Carol's points around thinking about the cost effectiveness of investing in these systems. I think to follow on the point, every donor-driven program in the world thinks that integration is the cost-effective solution. And what's going to happen when VHTs have 1,000 different tasks with differing incentive payments and all sorts of other stuff? Seems pretty unsustainable. How can we make sure that those investments in those systems do take place to keep out the promise of those cost-effective solutions? Omar mentioned a little bit about market situations, market structure. I think is also important to think about here. When we start playing with the private sector, the market characteristics matter, both in terms of the market structure of the industries that might be doing fortification within a country. I would add that when we think about broader market dynamics, price effects to consumers can theoretically go beyond 100% of the cost of fortification. If fortification regulations end up somehow creating trade barriers, reducing domestic competition, allowing prices to rise. So we need to think, I think, some of these uncertainties when we think about the cost effectiveness as well. Maybe just a couple of kind of closing thoughts on things that we need to do more on. I do think maybe we can be more demand driven in how we generate our data, how we think about what decision makers need, at what level of rigor, how to deal with presentation of uncertainty about some of our cost effectiveness stuff. Keith picked up on that a little bit already with some of his with sensitivity analyses. How do we deal with this when we are not comparing different degrees of awesomeness of our program, but comparing programs that are all awesome and have differing competing things going on? So thinking about uncertainty and thinking about exactly what it is that the users of this data will need ultimately. And I think also just to finally pick up on the point that Mina had made around the kind of ongoing M&E systems here, and Steve's point on making sure that cost data has influence. For long-term sustainable financing, we really need to do well on this. And in the case of donor-supported programs, being able to plan and make a joint case with governments for transition to full domestic ownership relies on us being able to really understand the costs of programs that are being implemented and moving it forward. So I think if we'd had time, we'd love to get Omar's perspective on Mina's point around the M&E systems here. I know USAID, along with Carol and some others, are doing some really interesting work on big costing efforts. But it'd be really interesting to understand as donors and as people like USAID, how we can build ongoing cost data collection into routine M&E. How can we think about the programs learning, adapting as they run, taking that cost information, incorporating it into how to make these things work better, and incorporating cost information into the kind of long-term sustainability plan for the programs that are supported. With that, I'll yield the negative balance of our time.
Thank you, Jack and Zia and Carol. We are out of time, but it's the sign of a really successful session, I think, when it's ending with more questions that we can be talking about and answering in future get-togethers. So thanks everybody for joining. All of the great questions that we got in the chat, we will be answering offline. And with that, I want to thank everybody, and we're going to close this session.